First of all, I hope we'll be building on the results or the discussion that we had in the past and be reviewing how we've been able to achieve the demands, the directions, the encouragement to do better things at home from the previous meetings. And I'm definitely hoping to be able to see how we'll be mobilizing resources to address those issues that are emerging. We've made significant progress, for example, in organizing the fight against tobacco. I'm certain that will be a major issue. For the past few meetings, we've put on the front burner the fight against NCDs. There's an emerging epidemic of NCDs. And if in the past, small countries like Guyana, small economies, did not recognize the fact that NCDs was an international issue, not only an issue for developed countries, it's now become very fixed in our health agenda. NCDs, the impact it has on the economy, especially on the able-bodied workforce, and more so and alarmingly, the emergence of such things as childhood obesity. And so we are joining in the international struggle against NCDs, and we've come here to learn those experiences. And many of the smaller islands in the Caribbean, CARICOM countries, they've been sharing some good experiences. And we are here to learn from those. We're here to put on the front burner NCDs. As a matter of fact, the prioritization process that was recently done by the international agency, by PAHO and other agencies, put firmly on as the number one issue the NCDs. So we'll be coming here to get those experiences, to get into new opportunities for leveraging resources for the fight against NCDs back home. And we're now about to present to the nation, to Guyana, to the Guyanese people, our new strategic plan for the next 5 years. And see, this is an opportune moment to be able to be at this meeting to pull from the international experience, from the international pool of public health practitioners, the best things to integrate into that strategy. But I can tell you up front, one will be the NCDs, things like active aging and mental health. But we've already seen from the discussions that we can gather so much from the experiences of individual jurisdictions and the top-level public health practitioners they have here. So that networking has been to the best of Guyana's benefit. In my view, universal health coverages can be put, as I've been putting it, over in Guyana, bringing more services to more people at more times by more specialists and more qualified personnel. And I think that's putting it in a layman's package so that the lay public can understand the essence of the discussion, and at the same time, it's put over in such a way that my healthcare providers can appreciate the role they're playing, the vital role, and at the same time value their services. So we're hoping to have access to quality care to the wide cross-section of the population without prejudice to their economic status. In other words, bringing healthcare, easy, accessible health care of a good quality to the wide sections of the population must at no time present a financial challenge, or after they would have been treated or after they have accessed that health care, it must not economically negatively impact on them. So we'll have to be discussing things not only of the quality of care, but the financing, new innovative approaches to financing public health and the public health sector, while at the same time working closely with the private sector, which also provide through insurance and of course through the private healthcare providers certain services. So that's how I put it in a nutshell and how I've been touting it, as it were, in Guyana. More services, more healthcare services to more people, more at more times, in more places, and by more practitioners. And we've been doing some good things in Guyana to achieve this. We have invested in human resources. Recently, we introduced into our system just over 300 newly trained, newly graduated doctors. That's a huge army, a huge force. I call them my wellness warriors. This is the wellness warriors army. And those 300 doctors added to the recently graduated in the past few years, 200, will allow me to take more services to more people at more places at more times, and of course with more qualified personnel. So we are spreading across a small country. Guyana is a fairly small country with this additional personnel. And at the same time, we are indulging in nursing training. We have indigenous nursing schools, and we have increased the input or the intake of nursing students. So hopefully we will be able to match structure and strategy. We have the strategy of getting more services to more people at more times, and at the same time, we're creating the workforce which will be able to deliver. So those are two things that I'm proud of. The amount of workforce that we've been able, especially medical doctors and nursing staff, to produce and continue to produce. And at the same time, the amount of small hospitals and health centers that we've, as a small economy, coming out of a dark period, that we've been able to build in remote locations. Some of these locations, Guyanese sometimes don't even know of, places like Letem, Mabaruma, Port Kaituma, places where previously services were restricted. We're hoping to bring them up to certain standards, especially by providing the medical personnel. Further to that, this large body of wellness warriors has been mandated not to be sedentary, not to be only stationed at the hospital that might have been built recently at Letem or Mabruma, but to move out in a structured fashion on what we call outreach visits. Here, sticking to the principle of more services to more people in more places. We've also started a process of opening some of our health facilities, which would have been closed at, say, 4 o'clock or 4:30 in the day into the evenings. It's a new experiment. So this is not at the hospital levels. Of course, hospitals are open around the clock, 7 days a week, but certain other facilities are now we're experimenting with opening them late into the evening. So you'll have more services to more people at more time. And this is aimed at certain population groups. For example, male health. Many men do not access our health centers. First of all, they don't think it's macho. They think that is for women and babies. And secondly, even if they were compliant, they have to work in the day. So we're hoping to give some opening to the male population so that they can come in the evenings after work, and so it's not compromising their economic activities. So those are some of the small innovations that we're doing, but this is where small innovations or small actions have a ripple effect, have the multiply effect. And those are some of the things we're doing to achieve more services at more times, to more people in more places by more practitioners. Universal coverage. Okay, I think in Guyana and in the Caribbean, PAHO has done a great job. And I think it has been done so because they rely on interfacing with the local practitioners. And this is a strength that PAHO has demonstrated. It's not an outside package imported and imposed. This is a country-driven process, and I think that is the way to go. We need to find innovative ways now of strengthening that country-driven process, and this is where we're going to be working. How do we get, for example, in Guyana, the larger number of healthcare providers that we've created over the past few years, how do we get them reaching more and more into the PAHO network, into the PAHO Guyana country network, so that the interventions or the innovations or the new approaches brought in by PAHO are truly country-owned. We have had a very good relation in this aspect, in this regard with PAHO. Our projects are country-owned, country-driven, and I think that's the strength, and we will build on that. Everything depends on that. There must be a total meshing, dovetailing of PAHO's activities in Guyana so that it becomes a country-driven, and this is what we found to be a strength, and we will build on that.